It's a unique combination of very comforting environment and at the same time, high standard education. I am Rami Nasir. I am a medical doctor. I left to Saudi Arabia with my young family, my wife and 2 kids, and stayed there for another 4 years. I was a contractor, worked also in anesthesiology. We came here to the United States in December 16th, 2015, and went through the loop of certification, went through the exams, and started my first year residency in Arizona, and I'm here now for my second year residency in family medicine.
So my name is Andrew Shu. I'm a 3rd-year family medicine resident here. So my family is Chinese. They immigrated here back in the 80s, basically around when I was born. They immigrated here as college students. My dad was a graduate, like a PhD level student at sociology. So we were in Indiana first, and then, it comes with the whole moving around the United States, looking for jobs and stuff like that. It was really hard for them to look for jobs. We actually wasn't able to get a lot of jobs because of various issues and didn't have good medical care or anything like that, so we were pretty poor the whole time.
Working here is such an experience. It's a knowledge experience, skills experience, and a spiritual one, in fact. I have been influenced by every member working here, from the nurses working on the desk outside. You don't imagine how helpful they are. Going through the residents, the preceptors, the specialists in the hospital, to me, it's a great experience.
The amount of independence is high here, and that feels good. It's not like a reckless independence where you just basically are left out by yourself to just try to make decisions and treat patients. It's more like the attendings and the culture around here is not nitpicky, and you don't have to still act like a medical student to ask every little thing to get approval for every little random thing that you already know. As several years into training, you already know what to do and whatnot. And also the nurses and the other ancillary staff, they respect us very much. They're really good at working with us, where there's got to be a good balance between autonomy versus being supervised.
What's great about our program is that we are what you call unopposed, which means you are the only residency here in the hospital. That means you also get to work one-on-one with the specialist here in the hospital, and you don't have to fight for different things. We can do anything that you would like with your residency as well. Another big thing that we have is that we're very flexible in everything that you can do. So if you have a special interest, say in colonoscopies, we're able to make sure that even once a month to twice a month that you're able to do that throughout your whole rotation. We do what's called a longitudinal program. And so what that also means is, instead of being put away into block schedules where you have 2 weeks or 1 month of certain specialties like surgery and that kind of thing, you actually do surgery throughout your entire 2 years here. Cardiology you can see once a month, so that way you can then bolster a good relationship, but also be able to go back and ask questions 3 months after you've started working with him. So instead of only having 2 weeks right away, it kind of spreads out all of that for you. As a program, you also spend your first year in Pueblo, kind of getting your basic work done there, and then you come to Alamosa for your 2nd and 3rd year. We have 2 slots per year for residents, and so it keeps it a very small program, which also helps significantly with your ability to change and do what you want with your learning while you're here.
I would say, intern year, and then even sometimes during medical school, there's some burnout in me personally, just because of the medical education system. It's very old school, and it's really rigid, and it burns out a lot of people and residents. I feel like my overall mood has actually gotten better and improved. My overall outlook, my optimism improved drastically. And that was actually good to feel. And every time I think about it, I was like, dang, I like this thing. Part of it has to do with that, there's only 2 residents per year, so we just automatically become more important. Here, I just feel like, I really help the patients out, and I have my staff here to support me with that. I get good patient continuity, like the same patients, they see me again and again. It's not like, they see me today and then they They see another person in another week because I've been rotated out, and then another one of the 30 residents have come in to be, seen as the clinic doctor. We get to know our patients. We see their children, their uncles, their niece, their grandparents. It's always fun to actually see those patients. I mean, sometimes we take time just to talk. They like to come in. It's like they're seeing a friend. It's like we're seeing a friend, and that's what small community medicine is about. As far as residency goes, this is one of the greatest I've seen.
For residents who like to have a new experience and learn a bunch of general medical medicine and a big group of hand skills and a special spiritual experience and learning about how we should deal with patients as people and persons and build that good doctor-patient relationship, it's a great place to go.
Thank you so much for taking the time to watch our video, and I'm looking forward to getting to meet and know you all individually.